Have you ever walked into a room and completely forgotten why you were there? Maybe you've misplaced your phone again, or stood in front of the fridge wondering what you needed. It happens to all of us. But after 50, many people begin to wonder, is this just normal forgetfulness? Or is it something more serious? Today, we're diving deep into one of the most searched health topics by adults over 50 in the United States: memory loss versus normal forgetfulness. We'll explore the difference between common age-related memory lapses and the early warning signs of conditions like dementia and Alzheimer's disease. Most importantly, you'll learn what steps you can take right now to protect your brain health and keep your memory sharp well into your later years. Understanding normal age-related forgetfulness. As we age, changes in memory are a normal part of life. The brain, like the rest of the body, experiences wear and tear. It's completely natural to occasionally forget names, dates, or where you left your glasses. This is called age-related cognitive decline, and it doesn't necessarily mean you're developing cognitive impairment or dementia. What does normal forgetfulness look like? Forgetting a name but remembering it later. Misplacing keys or glasses occasionally. Walking into a room and momentarily forgetting why. Occasionally losing your train of thought during a conversation. Being slower to recall details, but still retaining them eventually. These types of memory lapses don't interfere with your daily life. They're usually mild, infrequent, and you can often recall the forgotten information after a few moments. In fact, most people experience this kind of forgetfulness and never go on to develop any form of serious memory disorder. Why does this happen? As we grow older, the brain's processing speed naturally slows. The hippocampus, the region responsible for forming new memories, can shrink slightly with age. Reduced blood flow and hormone levels also contribute to memory slowdowns. But again, these changes are part of healthy aging, not signs of dementia. Studies show that individuals who continue to stay mentally and physically active into older age often maintain high cognitive function. When forgetfulness becomes a red flag. So how do you know when memory loss might be more than just normal aging? This is where early detection becomes crucial. Ignoring warning signs can lead to delayed diagnosis and missed opportunities for treatment or prevention. Here are 7 warning signs that your memory issues may signal a more serious condition, like mild cognitive impairment, MCI, or early-stage Alzheimer's. 1. Repeating the same questions or stories within a short time frame. 2. Forgetting recent events or conversations completely. 3. Getting lost in familiar places or routes you've known for years. 4. Difficulty handling finances or everyday tasks you once managed easily. 5. Struggling to find common words or follow conversations. 6. Withdrawing from social activities or favorite hobbies without explanation. 7. Changes in mood or personality, such as increased confusion, fearfulness, or suspicion. These symptoms differ from normal forgetfulness because they interfere with daily routines and gradually worsen over time. If one or more of these signs are present, it's important to speak to a healthcare professional for a full evaluation. The earlier these signs are caught, the more options are available for slowing the progression. It's also important to consider how often these symptoms are happening, whether they're worsening, and whether others have noticed them. Oftentimes, family and close friends may be the first to recognize subtle changes. Memory loss and cognitive decline. What's the connection? Cognitive decline refers to the gradual loss of brain function, including memory, thinking, and reasoning skills. While dementia is a general term for severe cognitive decline, Alzheimer's disease is its most common form. According to the Alzheimer's Association, 1 in 9 people over 65 in the U.S. has Alzheimer's. Mild cognitive impairment, MCI, is often a bridge between normal aging and dementia. People with MCI may notice increased forgetfulness, but are still able to function independently. However, the risk of developing dementia within a few years increases significantly for those diagnosed with MCI. Some common causes of memory loss in seniors include vitamin B12 deficiency, thyroid disorders, depression or anxiety, sleep disorders like sleep apnea, dehydration, medication side effects, especially from sedatives, antihistamines, or blood pressure medications. Knowing these underlying causes helps determine whether your forgetfulness is reversible or part of a progressive condition. Some memory issues can be improved simply by addressing these correctable causes. What to do if you notice memory issues? If you're over 50 and concerned about memory loss, the first step is to document your symptoms. Keep a journal of what you're forgetting and how often. Are you forgetting appointments? Misplacing items daily? Getting lost in conversations? Next, schedule an appointment with your doctor. You may be referred to a neurologist or undergo tests like memory and cognitive assessments, brain imaging, MRI, or CT scan, blood tests for vitamin levels, liver, kidney, and thyroid function. Early diagnosis is key. In many cases, catching cognitive decline early allows for lifestyle changes and treatment that can slow its progression. Your healthcare provider may also review your medications to determine if they could be affecting your cognition. Healthy brain habits to prevent memory decline. The good news is that you can take action now to improve your brain health and protect your memory. Here are 7 research-backed strategies to maintain and even boost cognitive function. 1. Follow the MIND diet. The MIND diet combines elements of the Mediterranean and DASH diets. It's rich in leafy greens like spinach and kale, berries, especially blueberries and strawberries, fish, nuts, whole grains, beans, and olive oil, limited red meat and processed foods. Studies show the MIND diet can reduce the risk of Alzheimer's by up to 53%. The emphasis is on reducing oxidative stress and inflammation in the brain through nutrient-rich foods. 2. Exercise your body and your brain. Regular physical activity increases blood flow to the brain and promotes new brain cell growth. Aim for 150 minutes of moderate aerobic activity weekly. Strength training twice a week. Daily movement like walking, gardening, or yoga. Cognitive exercises are equally important. Read regularly. Play strategy games. Learn a new language or musical instrument. Practice memory techniques. 3. Prioritize sleep. Sleep helps consolidate memories and clear toxic proteins like beta amyloid from the brain. Adults over 50 should aim for 7 to 9 hours of quality sleep. Avoid caffeine late in the day, reduce screen time before bed, and maintain a consistent sleep schedule. Sleep disorders such as insomnia and sleep apnea should be evaluated and treated. 4. Stay socially connected. Isolation increases the risk of cognitive decline. Regular contact with friends and family, joining a community group, or volunteering helps keep your brain engaged. Social interaction stimulates multiple areas of the brain, including language and emotional processing centers. 5. Manage chronic conditions. Uncontrolled high blood pressure, diabetes, high cholesterol, and obesity are all associated with a greater risk of cognitive decline. Work with your healthcare provider too. Keep blood pressure within target ranges. Control blood sugar levels. Maintain healthy cholesterol. Achieve and maintain a healthy weight. 6. Reduce stress and practice mindfulness. Chronic stress floods the brain with cortisol, which impairs memory. Practices like deep breathing, yoga, meditation, and even spending time in nature can lower stress and improve focus. Managing stress helps maintain clarity and emotional balance. 7. Limit alcohol and quit smoking. Excessive alcohol consumption and smoking are strongly linked to memory problems and cognitive decline. If you drink, limit yourself to moderate intake. If you smoke, talk to your doctor about quitting. Your brain and body will thank you. Vitamins and nutrients that support memory. Certain vitamins play a vital role in memory and cognitive function. Vitamin B12, essential for brain and nerve function. Low levels can mimic dementia. Vitamin D, deficiency is linked to poor cognitive performance and mood issues. Omega-3 fatty acids, found in fish and flaxseed, reduce brain inflammation. Magnesium, supports neuron communication and calms the nervous system. Antioxidants, like vitamin C and E, protect brain cells from oxidative stress. Ask your doctor about checking your levels and whether supplements may benefit you. Many older adults have silent deficiencies that can be corrected to support brain health. Normal aging versus dementia. A simple comparison. Let's break it down into a quick reference. Normal aging, possible dementia. Occasionally forgets names. Frequently forgets familiar names. Misplaces items occasionally. Puts items in strange places. Slower to recall information. Can't recall information at all. Maintains independence. Needs help with daily activities. Mood is stable. Noticeable mood swings. Understands when mistakes happen. Unaware of errors or repeats. When to see a doctor. Don't wait until memory problems become severe. See a doctor if memory issues disrupt work or social life. You get lost in familiar areas. Friends or family express concern. You notice increasing confusion or forgetfulness. Symptoms are worsening and frequent. You should also talk to a healthcare provider if you have a family history of Alzheimer's, as genetic risk can play a role. Take action today. Your brain is like a muscle. The more you use it, the stronger it gets. Whether you're 50 or 75, it's never too late to build better habits. Start by eating right, sleeping well, staying connected, and challenging your mind. Talk to your doctor about any concerns. And don't be afraid to seek help. It's a sign of strength, not weakness. Memory loss doesn't have to define your future. You have the power to take control of your brain health starting today. If you found this video helpful, hit the like button and subscribe for more weekly tips on healthy aging, brain health, and memory care. Share this with someone you care about, because protecting our memories means protecting our lives. Stay sharp, stay strong, and take care of your brain. Every day counts.